Hello. Today we're talking about breast augmentation, which is one of the most commonly performed plastic surgical procedures in the United States with an extremely high satisfaction rate. There are, however, certain considerations one has to be aware of before undergoing the procedure. The first is implant selection. Do you want silicone or saline implants? These are saline implants. They're filled with salt water, which is absorbed by the body if they deflate, but they feel somewhat less natural than their counterpart silicone gel fill implant. On the other hand, while these silicone implants feel more natural in most patients, and while the risk of rupture is lower than with saline, the gel is cohesive and therefore isn't absorbed. The rupture, in many of these cases, is difficult to detect. Therefore, it's recommended an MRI be performed every several years to evaluate them for leakage. The other consideration is where to place the implant, either above or below the chest muscle. The amount and quality of tissue together with the amount of droopiness will help you and your surgeon determine the best location. It's also important to understand that these are not lifetime devices and that over the course of time you will likely need to have additional surgery. The most common reasons for revision are for capsular contracture or hardening of the breast, malposition, and progressive droopiness of the breast. Finally, having realistic expectations with regard to size is paramount in being happy with your result. Computer imaging, preoperative sizing, and an honest discussion with your surgeon about your goals will go a long way in aligning your expectations and being satisfied with your results. So for those of you interested in breast augmentation, my take-home message is this: do your homework, seek the advice of a board-certified plastic surgeon who understands your goals, and be aware of the limitations of surgery before proceeding. If you would like to learn more about this procedure or any other, please give us a call at 201-261-7550. Thank you. I just want to show you the differences between the silicone and the saline implants in the event of a rupture. We talked about the silicone implants being cohesive gel. This is a silicone implant. If I cut that implant right in half with scissors, the gel will be very tacky and bulge and retract just like that, you can see. But it maintains its shape. The silicone doesn't run out. And it stays together, therefore cohesive gel. I can cut this further, right in half, and it will have the same effect. There's that implant cut right in half, and you can see the gel just bulges and retracts, but maintains its shape. And here's the other half. A saline implant, if it leaks, will simply be absorbed by the body. This is a saline implant, and if there's a little hole in it, as you can see, the saline runs out, gradually deflating until there's no more volume left. So your body will recognize the deflation right away because there's no more volume. On the other hand, with the silicone implants, because the volume is still within the implant, your breast won't change size. And that's the difference between both of them, and why with a silicone implant you typically need an MRI to detect a rupture. That's the difference.
I've got you under my skin.